So this one isn't necessarily a myth, but it is something I wanted to start out with because it's the reason why I am no longer in medical school. So a lot of people kind of have this idea that doctors know why diseases happen, and that is far from their profession, far from their job, or far from what they do. Doctors treat patients, plain and simple. That's all they do. All they do is treat the patient. They look at the disease that was given and they treat it based upon the things that researchers told them that they need to do. That's it. If the research hasn't been done, they don't know. If nobody else has asked the question before them, the research probably has never been done, so there's no answer out there. So I say all this to say that sometimes we get confused as to what exactly the purpose is of the doctor that's sitting in the hospital. Sometimes we think that they're there to figure out why something is happening, but that's really not what they do. They're there treating the people that are there. So if you're not a people person and you don't like to interact with people and try and figure out what's going on with them, then you're probably not fit to be a doctor. So if you aren't a people person, being a doctor is treating people. It's a huge part of what it is. You can't get around it. Even if you want to spend all your time in a research lab, you're better off going for your MD, PhD, or just your PhD than going through and being a doctor. Medical doctors treat patients. They treat people. That's what they do. Yeah, I just wanted to start out with that. Not necessarily a myth, but it's something that is super important to make sure that you understand what exactly you're getting into. Because if you don't want to do what physicians end up doing, then don't go to medical school. Go do that medical adjacent thing instead of going to medical school and then trying to tweak what being a doctor is to fit what you want to do in the end. And low-key, I just kind of read myself, so I'm just going to go ahead and skip on to the first real myth. So the first major myth I could say that a lot of people are debunking nowadays, because I'm super proud of, is the fact that you have to kind of isolate yourself or not do anything fun when you're in medical school. That you have to spend all of your time studying 24/7. And that couldn't be far from the truth. I know a lot of classmates that spend a lot of medical schools traveling and going all over the world, especially in their breaks and stuff like that. We would get a week in between our blocks. And I know some of my classmates that spent every block break in a different country because they took out the loan money and decided that that was going to be their opportunity. They weren't going to miss out on fun things just because they were in a hard program. So just make sure you have your priorities together when you're going to medical school. What is important? And once you determine what is important to you, that will determine what you do with your time and what you do with the different things that you have. You don't have to spend all of your time studying, but you do have to study. So you want to make sure that there is a balance and a method to the madness. So yeah, I would definitely say my first one is thinking that I had to spend all my time studying, that I didn't have to see anybody, I couldn't do fun things, I couldn't go home for breaks and for parties and stuff, because it's possible. You just have to plan out your breaks, plan out your schedule, and make sure you are not procrastinating and staying ahead of the game. That allows you to be able to do what you want to do when the things come up in your family. But know that you aren't going to be able to attend everything. So I would say my second major thing that I kind of went into as an assumption with medical school, but ended up to be completely wrong, is the idea that the environment was super cutthroat. Like, you know how you'll hear about in schools and movies and stuff like that people are blacking out words in textbooks, tearing out pages and stuff with practice books and all this different type of stuff to prevent other classmates from succeeding. Well, that is the last thing I experienced when I went to medical school. I tell you, my classmates were super helpful. We shared everything. And that's the one thing I think I really enjoyed about being in my school, is that nobody really fought to get ahead of anybody in the sense of, I'm not going to give you this resource, or I'm not going to give you this thing, or I'm not going to show you where the helpful note is in the book that I used to get me there, or helpful videos. That was a great thing that was that I got out of my classmates, is that a lot of people would find helpful videos and they would just post them in the Slack. And that was great because it prevented me from having to search for them. So that was one thing that I can say definitely surprised me about medical school. And even the school I'm at now is still a school of medicine. I'm just not in the medical program, but even there, I noticed a lot of the students are studying together, using textbooks together, encouraging each other to use resources and stuff like that. It doesn't seem like that cutthroat environment that I thought medical school would be. So I would say my next one is they kind of go hand in hand with both the in-medical school process and also the application process. That you don't have to make straight A's to get into medical school or be a successful medical student. First of all, I'm sure it's been debunked thousands of times at this point that not all straight A students get into medical school. The students that have the best grades typically don't make the best physicians because they're typically pretty cold people that don't really care about the patients. All they care about is the information. But I digress. So that's why it's important, and that's why medical school admissions councils and stuff like that are placing emphasis on clinical experience, volunteer opportunities, your personal statement, letters of recommendation. They want to know you're a good person. Anybody can make good grades and memorize information, but not everybody can learn interpersonal skills and how to talk to somebody and learn how to just care generally about the people that they're caring for and stuff. That is what makes a great physician. So nobody cares if you have straight A's. Shoot, most medical schools nowadays are transitioning from looking at letter grades to actually just doing pass-fail, because that's what the USMLE is. It's pass-fail now. So they don't even really care about you making an A, B, C, D, E, F, G. So you shouldn't either. If you've gotten to medical school and you're making C's, baby, you're doing great, because most people wouldn't even be able to get to medical school and even pass the exam. I had to start realizing that when I was in medical school, that you're taking an exam that the average person would not be able to even get a 10 on. So you have to praise yourself for getting that C, if that C is all you got, because you're doing the best you can do, because you're getting a ton of information. So just because you have a bad day doesn't mean you should beat yourself up. A lot of the medical students that I talk to when they interview for residency, they say most of the time the residency director doesn't even ask about their grades, because that's not what's important. What's more important is what's said in your third and fourth year when it comes to rotations, and you interacting with patients and that stuff. The only reason they care about your first 2 years is really to see, okay, you passed step 1, which lets us know that you have a good basis of what the basic science information means. And that's really the only reason you take those classes, the only reason you take those exams. So you can take step 1, which is a test of you understanding the basic science behind all the medicine that you're about to now apply. So please keep the big picture always in mind when you're talking about medicine, and when you're looking at medical school, and when you're looking at the different things that you're doing in medical school. None of it is just individual. All of it is put together, and like at the end of the day, they want to make sure that you're going to be a great physician. Great grades don't always equal great physician. So think about the qualities that a physician has, and those are the things you should be striving for, not just stats on the spreadsheet that they can check off. So this one is kind of about the approach when looking at learning in medical school. If you're spending the time memorizing the content, you're doing it wrong. You need to be applying the content. You need to be looking at the content in the context by which you're going to be looking at it with the patient. So if you're only looking at the drugs and the side effects and the mechanism of action and the indicators for using it in a slideshow presentation, but never looking at it in a question, you're never going to get the questions right. I can tell you that from experience, because that's what I did. I tell you, you're not going to get the questions right. You need to look at the questions and look at the stuff in the context. Because when you read the same questions about the same, well, not even the same questions, but questions that are about the same drug, you'll notice that they give you the same indicators or similar indicators every time. They give you the similar clues every time. So you need to see the information in the question stem. Because if you see it in the question stem, I promise you will notice the things that you need to know that are important. And you will stop bogging yourself down on all the things, all these facts and random things that the professor's giving you. Also, look at the questions that you have been given in the past, even if they aren't related to this drug. What are the constant things that are being brought up when they talk about a drug or they talk about a disease? Every time they talk about pathology, every time they talk about symptoms, every time they talk about these particular lab values. So I should probably know these things about this disease. Or I should probably know these things about every disease when they come up. Because those are going to be the things that help you differentiate the diseases. So use the questions to your benefit, not just for studying in the sense of getting in questions, but also see how the questions are formatted so you can understand the important things generally that you need to be grasping from each disease you learn, and from each drug you learn, and from each whatever you learn, okay? That's why I say medical school is not about memorization. It's about applying. It's about looking at all the information you have gotten and determining what to do with it. Because if you just look at the information and memorize it, I promise you're going to fail. I promise. There's no ifs, ands, or buts about it. If you want to know how to fail medical school, that is how you fail medical school. That's how you do it. I promise that's how you do it. So do not waste your time just looking at the pieces like that and thinking that you're just going to be able to look at the sheet, memorize all the information there, and it's going to happen. And you're going to get all the questions right, because that's not going to happen. It's not. So keep that in mind when you're thinking about medical school, and understand, and start doing that in the classes that you're at now. Applying the information. Even if there's a class that's based in memorization, apply the information. Because if you apply the information, you know it. You have it memorized. You can't apply information that you don't know. It's in the next step on the learning ladder, if you want to call it that. So understand that you have to memorize it or have to know it first to apply it. So you're doing that memorization step to get to the application step.